Around 90% of new infections are now the Delta variant, which was first recorded in India. Cases are reportedly doubling every 9 days and has put the June 21 Freedom Day at risk. Independent SAGE's Professor Anthony Costello, from University College London, said the real number of new infections was likely to be twice the 8,000 new daily cases revealed by tests. He added, in a month you'll be up to 100,000 new cases a day. If the government takes a gamble and lets rip like Tory backbenchers want, the NHS will be overloaded. Let's wait. Let's stay as we are. British Medical Association boss Dr. Chand Nagpal added, it's not just about hospitalizations, but also the risk to large numbers of younger people, who can suffer long-term symptoms. Mr. Johnson is set to delay the ending of lockdown until July 19 to allow more people to be fully vaccinated against coronavirus, according to sources. Cases of the mutant Indian strain have surged by 240% in the last week, prompting concern in Downing Street. Under plans drawn up to be announced on Monday, a 2-week review will be included, meaning COVID restrictions could be dropped on July 5 if hospitalizations stay down. Any delay will also give more people in their 40s a window to get their second dose of the vaccine and for it to take effect before restrictions are fully lifted. However, Shadow Home Secretary Nick Thomas-Symonds said any delay would be a huge blow for families and businesses. She said, any delay would be a huge blow for many families and businesses. The fault lies squarely with ministers. They continued with a reckless border policy that let the Delta variant reach here and spread. Independent SAGE scientists warned schools would have to introduce masks as 136,000 children are now absent. Due to the UK's vaccine rollout, fewer patients are ending up in hospital but more are being admitted than released, and 55% of the country are not fully vaccinated. The Delta strain from India is 60% more transmissible, and one injection of the Pfizer or AstraZeneca vaccines gives only 33% protection against it. However, Mr. Johnson warned the Delta variant is a matter of serious concern. The Prime Minister said, we don't know exactly to what extent that will feed through into extra mortality, but clearly it's a matter of serious concern. We want to make sure the roadmap is irreversible, but you can't have an irreversible roadmap unless you're prepared to be cautious. The scientists are agreed about one thing: they do not think there is any case for going into reverse. Professor Neil Ferguson said there is a risk of a substantial third wave of COVID infections in the UK, driven by the Delta variant. Speaking at the Science Media Centre briefing this week, he said, there is a risk of a substantial third wave. We cannot be definitive about the scale of that. It could be substantially lower than the second wave, or it could be of the same order of magnitude. He added the size and scale of the wave will be contingent on the efficacy of the coronavirus vaccines, particularly in light of the extent to which they quell the number of deaths and hospital admissions. Professor Ferguson said, almost certainly I think deaths probably will be lower. The vaccines are having a highly protective effect. Cases in hospital now are milder, but it still could be quite worrying.